Good afternoon. I would like to thank each and every one for you being here at live this session for MAHSA University from MAHSA University Savjanaputra campus. I'm Rahul Krishnan, lecturer from the Faculty of Health Sciences, Nursing and Education, MAHSA University. I will be moderating today's session. Today's webinar, the Female Athlete Triad, Addressing Challenges with Physiotherapy Solution, is proudly organized by the Faculty of Health Sciences, Nursing and Education, MAHSA University. Dear viewers, before we proceed further, I would like to give you a brief overview of the programs offered at the Faculty of Health Sciences, Nursing and Education at MAHSA University. All right. So moving on to the Faculty of Health Sciences, Nursing uh, and Education. It has various departments and school. One of the two big schools which has got School of Physiotherapy and School of Nursing, School of Education, Department of Environmental Health, Department of Medical Imaging. The School of Physiotherapy has got various programs. One of the prominent program is Diploma in Physiotherapy, Bachelor of Physiotherapy Honors, Bachelor of Physiotherapy Honors Open Distance Learning, Masters of Physiotherapy. Moving on to the Department of Environmental Health, we do offer Diploma in Environmental Health, Bachelor of Environmental Health and Safety Honors, Bachelor of Environmental Health and Safety Honors ODL program, Diploma in Occupational Safety and Health. So these are the few programs which comes under the Department of Environmental Health. Moving on to the Department of Medical Imaging, we do offer Diploma in Medical Imaging, Radiography, Bachelor of Medical Imaging Honors, Bachelor of Medical Imaging Honors ODL. Moving on to why we have why to join the health science group, or what is the benefits, or what is the perspective if you look at as I could go through it. What I can explain you about is the high job demand essential. So it comes under the essential services. So the students who have taken the courses or completed the courses from our program, they have high job demand. No risk of job vacancy and cannot be automated. So there will be always a demand of health workers or health science uh, graduates from in the country. Opportunity to work in various varieties of settings, a career you can feel good about, and of course the market outside, or the market is quite welcoming, where you have a lot of job opportunities and so on. Talking more about the master's program in physiotherapy. So master program in physiotherapy, we provide in two ways. One is the full-time mode and another one is the part-time mode. So the full-time mode is a 1 year program, whereas the part-time mode is for 2 years. And these are the few entry requirement, and this details you can also find on our web page. Moving on to the other programs which you would be more looking at, the School of Physiotherapy, are Bachelor Program of Physiotherapy Honors, which is a regular program, and we do also have open and distance learning. To moving through the environmental health, as I just mentioned before, these are the bachelor degree program in environmental health and in medical imaging. Uh, the entry requirement details are available on our web page. Moving on, the diploma programs, we have diploma in physiotherapy, diploma in environmental health, and diploma in medical imaging. As these are the entry requirements, and for further details, you can visit our web page. Uh, Diploma in Occupational Safety and Health, which is a 3-year program, which is also offered at our faculty. And these are the entry requirements, and the further entry requirement details are available on our web page. And excellence in what MAHSA aspired to provide is great to the graduates. So the next is why to choose Faculty of Health Sciences MAHSA. As I can jot down some of the few points. One of them is experience and dedicated international pool of academic staffs. We have various study modes like the conventional mode. We have the open and distance learning. Plus, we do also have cross teaching by expert, where MASA has most of the numbers of health disciplines in a single institute, and we do have the cross teaching facility. Our teaching sessions are quite interactive, and we more focus on the hands-on clinical skill, which again has got two options. One is like face to face, and we do also have in online platform. To another advantage of joining Faculty of Health Sciences MAHSA University is we have a wide list of hospitals and institutions which prepare our students for best clinical and industrial placement. To add on, we are also accredited by the MQA and JPA with international recognition. And our Bachelor of Physiotherapy program is a dual awarded from Angela Ruskin University, UK, United Kingdom. We also offer varieties of scholarships, which few of them are being displayed. And for further details, you can very well reach to our web page. We do have certain collaboration and affiliations, which makes our program globally accepted, and which includes World Confederation of Physical Therapy, and we are also associated with Malaysian Physiotherapy Association, Malaysian Society of Radiograph, International Federation of Environmental Health, and so on. These are the few pictures or few of the glimpse of our student mobility program. So student mobility program is basically we have an exchange program from an external university where our students would be visiting the university and vice versa to have an knowledge sharing, and that would be in a part of the student mobility program. And this is again some of the glimpses where our students have visited different part of the world. And I would welcome you all to join us the Faculty of Health Sciences. Thank you. So please contact us through our MAHSA website or through our faculty Facebook page to know more about our programs, or simply leave a comment and we will get back to you. Your questions concerning this webinar sessions can be listed in the chat box. Now, let's welcome or move towards the webinar. So welcome to the webinar, and the webinar named as the Female Athlete Triad, the Addressing Challenges with Physiotherapy Solution. Today, we dive into the distinct challenges and opportunities in optimizing health and performance for female athletes. Women face unique physiological, mechanical, and hormonal factors that influence their risk of injury and recovery patterns, from anterior cruciate ligament tears and stress fractures to managing hormonal cycles and energy availability. This results in demands of tailored physiotherapy approaches. Join us as we explore the evidence-based strategies to address these challenges, enhance athletic resilience, and empower women to perform at their peak, both on and off field. Now, let me introduce today's speaker. Speaker of today's webinar, our expert, Ms. Nisha Achari. Ms. Nisha Achari holds a master's degree in physiotherapy with a specialization in musculoskeletal and sports injury. With 6 years of experience as a clinical physiotherapist and a lecturer, she has earned her expertise in managing soft tissue and skeletal conditions and mentoring body physiotherapists. Her areas of interest spans from musculoskeletal disorder, kinesiology, human biomechanics, and women's health physiotherapy, reflecting her dedication to improving patients' outcome and advancing in this field. Ms. Nisha, this screen is all yours.
Thank you, Mr. Rahul, for such a wonderful introduction. Good afternoon, all. Myself, Nisha Achari, and today I will be talking about the Female Athlete Triad addressing challenges with physiotherapy solutions. So, now let's begin with my webinar. The Female Athlete Triad addressing challenges with physiotherapy solutions, which is proudly presented by Faculty of Health Sciences, Nursing and Education. These are the contents for my webinar. We'll see what are the common injuries in female athletes. We'll see what are the challenges faced by female athletes in sports. We'll see what are the contributing risk factors for injuries. Most important, we'll see what is female athlete triad. We'll see some of the injury prevention strategies in physiotherapy, evidences based practices, and references. Introduction. Female athletes hold a vital place in the world of sports, contributing to its diversity, dynamism, and growth. Their participation not only highlights athletic excellence, but also serves as a powerful catalyst for social, cultural, and economic progress. In today's webinar, we will discuss about the challenges and injury risks female athletes face in sports compared to the male counterparts and the physiotherapy prevention strategies and solutions for female athletes. Let's see what are the common injuries in female athletes. Most common injuries are anterior cruciate ligament tear, patellofemoral syndrome, ankle sprain, plantar fasciitis, stress fractures, and concussions. So, if you look at the lower extremity injuries, contribute 60 to 70 percentage of all the sports injuries, whereas the upper extremity contribute for another 10 to 20%, head neck injuries 5 to 10%, and spinal cord injuries will be around 10 to 15%. Before moving on to the challenges and the risks, let's see what are the facts and figures, the injury risks in female athletes. So the five difference in the female anterior cruciate ligament when compared to the male, it is it is seen that women are more commonly born with knock knees, which put the anterior cruciate ligament at risk. Women are more commonly loose jointed, which puts all the ligaments at risk. The anterior cruciate ligament is smaller related to their body size in women. Females tend to land more straight leg when they jump than men. Women have monthly hormonal related changes that leads to the stiffness of the anterior cruciate ligament, which men usually don't have. Before going on to the main topic, we'll see how the woman, how what was the milestone or the timeline of the woman's participation in the Olympics. So if you look at the participation ratio of men as to women, it is seen that men as to women participation ratio in Olympics is 59 as to 41. That means the participation of women is still less. So if you look at the 1896, in 1896, there were till 1896, there were no women participation in the International Olympic International Olympics. By 1900, 22 women participated in the lawn tennis. By 1912, uh, swimming was allowed, but the swimming also they were told to do swimming wearing the long skirts, which were a difficulty for the women again. Then by 1928, the track and the field games were introduced, and by 1990 there was this pleasing events where the aesthetically pleasing events like gymnastics were only allowed. So you can see the milestone of how the women have slowly entered, and by 2018 the female athletes also participated in the soccer. By 1960 only 30 percentage of the female showed the participation. Now at least it's by 2018 it's 41 percentage of the female has participated in the Olympics. Now let's see what are the challenges faced by female athletes in sports. So talking about the physiological challenges, there are these injury risks. Female athletes face specific injury risks such as anterior cruciate ligament tears, which are more prevalent, especially due to the anatomical and hormonal differences. There is this hormonal fluctuations which can impact the performance, training consistency, and recovery. These are the menstrual cycle effects. Then there is this challenges which is faced by women, especially during pregnancy and postpartum, in balancing and in training, because there is this hormonal changes that can be seen in pregnancy. There is this roller coaster ride of hormones that happens during pregnancy. There is this relaxin hormone taking the role, and it is more challenging when a female becomes mother. It is more challenging for her to participate in the sports activities. Next, if you look at the challenge is the pay and the resource inequality. It is often seen that the female athletes frequently earn significantly less than male athletes in terms of salaries, prize money, and endorsements. Women's sports often receive fewer resources, including training facilities, equipment, and coaching expertise. Then is the very important societal pressures and the image expectations. Then the female has this body image issues. Athletes often face their scrutiny over their appearance, leading to body image concerns and eating disorders. Cultural expectations are in many cultures, women are expected to prioritize family or tradition roles over the sports. Then nowadays, it's the mental health challenges. Women in sports often feel heightened pressure to prove their worth and seeking help for mental health issues that may be stigmatized, especially in male dominating sports cultures. Gender discrimination, female athletes often receives less media coverage and sponsorship than male. And the lack of female representation in leadership, there is often shortage of female coaches, mentors, and administrators in sports organizations. Harassment, female athletes reports experiences of sexual harassment or abuse by coaches, officials, or teammates. Religious barriers, strict dress codes in sports may conflict with cultural or religious practices. Now, these are all the challenges which women go through. Okay, so now we will see what are the risk factors causing the injuries, especially in female athletes. So these are actually, we can term it as unique risk factors which a female encounters. So the risk factors are, we can see anatomically, neuromuscular, hormonal, and environmental. So if you look at the anatomical risk factors basically talks about the structural differences in the female anatomy. We can see there is differences in pelvic width, differences in tibiofemoral angle, width of femoral notch, joint laxity and flexibility, magnitude of quadriceps femoris angle, jumping and landing characteristics. When you look at the quadriceps femoral angle, which is also, you all know that it is known as the Q angle. So Q angle is something that we measure the alignment of the quadriceps muscle from the ASIS to the midpoint of the patella. Okay. So normal ranges of Q angle is 10 to 15 degrees in males and 15 to 20 degrees in females due to their wider pelvises. Clinical relevance of the Q angle is that increased Q angle can be associated with conditions like patellofemoral pain syndrome, chondromalacia patellae, or lateral patella tracking issues. Common in conditions like knock knees, that is the genu valgum. There is decreased Q angle can be seen in bow leg deformities, that is known as genu varum, or medial knee stress, which is mostly associated with old aging. Next anatomical risk factor is about the femoral notch. So the size of the anterior cruciate ligament is smaller in women than men, but no difference between the notch width index. Size determines the width and the shape. Smaller notch increases the rate of anterior cruciate ligament injuries. Women have narrow notch compared to men due to height and weight covariance. Women who were tall than male comparatively have narrower femurs for all the height. Volume of femoral notch is smaller in women compared to men due to height differences. So the recommendations are surgeons or orthopedics choose something known as notchplasty to widen the femoral notch when they are reconstructing the anterior cruciate ligament injuries. But studies shows that this surgical procedure be avoided because scientific justification is lacking at the present time. Next anatomical risk factor is about the joint flexibility. Joint flexibility is greater in women than men. Relationship between flexibility and injury is not yet clear. Several authors try to relate ligament flexibility with increased chances of injuries. For example, football players having loose joints suffered more knee injuries. Other studies disputed this claim. Recommendations are joint flexibility is inherited within an individual, so it is possible to strengthen the muscles around flexible joints. Talking about the next factor, that is the neuromuscular risk factors, men tend to have larger and stronger quadriceps due to greater muscle mass and high testosterone levels. Men quadriceps activation is often balanced with hamstrings, providing better dynamic knee stability, whereas women may rely more heavily on the quadriceps for knee stabilization, increasing stress on the anterior cruciate ligament. So why happens this is here written. Men have more of the type 2 fast twitch muscle fibers in hamstrings and quadriceps when compared to women who have more of type 1 slow twitch muscle fibers. If you look at the strength ratio of hamstring to quadriceps in men, it is somewhere around zero point 0.6 to zero point 0.8, whereas in women, the hamstrings to quadriceps strength ratio is zero point 0.4 to zero point 0.6. Next, when you look at the hormonal risk factors, so when you look at the hormonal cyclic changes which a female goes through every month, so there is this menstruation followed by the follicular phase, the ovulation, and the luteal phase. So in each phases has got different hormones taking up the charge. So during the menstrual cycle, when the female is menstruating, during that time, the follicle stimulating hormone is being released by the anterior pituitary gland. So anterior pituitary gland triggers the ovaries to develop the follicles. So by the 14th day, as the follicle gets mature, it will release the egg, that is the ova, female gamete, female ova. So when the female ova is been released, so next is the largest follicle, which is known as the corpus luteum, which so the ovulation, before that the ovulation happens because of the estrogen hormone that has been released by the follicles, and thus the ovulation happens, the egg gets mature and the egg is released, whereas the mature egg inside the ovary, that is on the corpus luteum, which will secrete the hormone that is known as progesterone. So progesterone is basically maintaining the luteal phase. If at all there is some pregnancy happening, that is the maintenance done is by the progesterone hormone. If not, then again the corpus luteum will shrink back into corpus albicans, and then there is this commencement of the another menstrual cycle. So this cyclic changes happens in every female every month with the days of 28 to 30 days. So you will get your periods as early as 21 days or as late as 35 days. That's very normal. So we'll see what are basically the relationship of these feminine hormones with the injury risk. So if you look at the estrogen will be peak during ovulation phase. So what happens because of this estrogen hormone, there are increased anterior cruciate ligament injury risk, reduced ligament tensile strength, affects the collagen synthesis and decreases the tendon stiffness. Whereas in the luteal phase, we know the progesterone hormone is synthesized or released by the corpus luteum. So this also has got some effect on the injury risk. It increases again the ligament laxity, joint instability, and fluid retention, which can affect your biomechanics. Then there is this hormone known as relaxin, which is mostly secreted during pregnancy, which also has got effect on your joints, especially in the pelvis and the lower limbs, leading to again the instability and the chronic injury risk. Next, we see what is the environmental risk factor, which is the fourth factor. So, extreme cold and hot weather can cause injuries to athletes. Extreme heat can produce heat cramps and heat exhaustion, whereas extreme cold may cause frostbite and hypothermia. So uneven, wet, icy surfaces causes falling, collision, sliding of the players. So in an epidemiological study conducted, shown that there is anterior cruciate ligament injury rate in females is on the higher side with high friction artificial floors than on wooden floors, and there is also significant role in shoe surface friction, principally the shoe type and the floor maintenance. So these are the four factors which are actually triggering or the main factors which is causing the risk in female athletes. Next, moving on to the title of our webinar, that is Female Athlete Triad. So what is Female Athlete Triad? So in the year 1997, the term Female Athlete Triad was coined by the American College of Sports Medicine as a spectrum of symptoms and conditions between health and diseases. Female athlete triad is a condition seen in athletic girls and women, which includes the three conditions. The first is the low energy availability. Second one is the menstrual disturbances. Third one is the low bone mineral density. So this low energy availability happens because of the disordered eating, restricted eating, or not enough eating in case of the athletes. Talking about the menstrual disturbance, it is the studies say that if the female is overworking or doing the activity or exercising, this may cause irregular periods and amenorrhea. Amenorrhea means there is stoppage of the menstrual cycle. Then there is this third thing that is known as the low bone mineral density. Low bone mineral density, there is osteopenia and osteoporosis that can be seen. So this is basically happens because of the low mineral density in the bone, which is mostly because of the low weight bearing exercises done, or because of the less calcium and vitamin D3 intake in the diet, or else because of the estrogen hormone. So estrogen hormone is a biggest hormone, which is basically building up the osteoblasts. So if there is decline in the estrogen hormone as the female ages, there is this osteoclastic activity seen in the bones. Because of that, there can be this osteopenia and osteoporosis. Osteoporosis is nothing but the brittle bones. Because of the osteoporosis, there are high chances of getting stress injuries and concussions in female athletes. Complications of female athlete triad. So if it is not assessed or checked by the coaches and the mentors, so there can be these complications in the future run. So menstrual disturbance can lead to infertility, Low levels of estrogen can result in increased risk of cardiovascular diseases like stroke. Women with the triad have decreased immune function. Many athletes with low bone mineral density or menstrual disturbances or irregularities suffer from stress fractures. Low energy availability can cause nutritional deficits and negatively impact the body's ability to build bone, maintain muscle mass, and recover from injury. Increased risk of depression, low self esteem, and various anxiety disorders have also been noted as a complication for the female athlete triad. And talking about the female athlete triad, it is found that 78% of the female high school athletes meet this criteria, whereas 65% of the female high school non athletes have got the female athlete triad. Now look, now we'll see how to assess the female athlete triad. There is this screening tool which is the female athlete triad questionnaire. This questionnaire basically asks questions about the body weight, the foods the female eating, what is the image appearance, does the weight affect the what you feel about yourself, then how much have you lost the weight, are you on any diuretics or laxatives, do you are you suffering from any of the eating disorders, or do you eat somewhere in secret, so how is your menstrual cycle, is it regular, the flow, uh, how, how is your monthly cycles, how long is the cycle, how is the flow of the cycle, how many menstrual cycles have you had in the last year? Do you miss any menstrual cycle or any other associated complications do you have? Or recently you met with any fracture or fatigability, stress fracture? So this is a questionnaire basically set for the female athlete triad. Other than that, the physical examination includes the measuring the height, blood pressure, physical signs of eating disorders, then skin assessment, percentage of body fat, which can be assessed with the help of fat calipers, and the musculoskeletal injury assessment. Other than that, the laboratory assessment includes the hematological, the blood reports, which will detect your ESR, the infection, if you are having any associated infection, the levels of the ferritin, that is the iron, vitamin B12, folates, then the biochemistry, talking about the electrolytes, then phosphorus, calcium, cholesterol, total protein, total albumin, then hormone profile, which includes the thyroid stimulating hormone, T3, T4, then pregnancy tests, urine analysis. Then others include electrocardiogram and the bone mineral density examination. Bone mineral density examination is done by a scanning that is known as the DEXA scan, which is your dual energy X-ray absorptiometer. So, in which they will assess the density of your bone. So the scoring is like T score. If it is -1 and above, it is considered normal. So if your T score is somewhere around -1 to -2.5, then you will be under the osteopenia. That means your bones are very flexible. It is like liable to break. And if your T score is more than 2.5, that means you are definitely osteoporotic. That means your bones are brittle and there are high chances of getting stress fractures in future. Next, we'll see what are the prevention strategies, physiotherapy prevention strategies for female athletes, like how we are going to prevent the injury. So there are these four basic steps which all of the sports physiotherapists follow. So these are the sequence. First, we will be establishing the extent of the injury. We'll see the incidence and the severity, then followed by we'll see what is the etiology. We'll try to find out what is the cause for the injury, followed by we'll see what is the mechanism of the injury. Later, the third step, we will introduce with some preventive measure. Fourth step is we will assess its effectiveness by repeating the step one. That means we'll check for the extent of the injury, we'll see the incidence and the severity. So this is the basic four sequence of sports injury prevention. Now let's see what are the factors, like how we can prevent the sports injury. So these are the 9 factors which being a sports physiotherapist we follow. First and foremost is the warm up. Warming up of the muscles is very, very important. Second one is stretching. Third one is taping and bracing. Fourth is protective, using protective equipment. Fifth one is suitable equipment. Sixth one is environmental factor. Seventh is appropriate training. Eighth one is psychology, and ninth one is about the nutrition. So when we talk about the warm up is something that we do prior to any sports. So there are two types of warming up, which can be general or specific. General exercises include, for example, your jogging. Specific exercises can be appropriate movements for the particular sport or activity. So, the possible benefits of warming up is it will improve or increase the blood flow to the muscles, it will deliver the oxygen to the muscles and increase the breakdown of oxyhemoglobin, it will decrease the vascular resistance, it will reduce the muscle viscosity, leading to smoother muscle contraction, it will increase the speed of nerve impulses, it will enhance metabolism and decrease the number of injuries due to increased range of motion. It will decrease the stiffness of connective tissue, leading to decreased likelihood of tears. It will increase the cardiovascular response to sudden strenuous exercise, and it will decrease the sensitivity of muscle stretch. So prevention exercises also include your squat jumps, broad jumps, squat holds. And talking about, like I previously mentioned, that female have the habit, or the way the female do the landing is they will be mostly landing with straight leg. So we have to basically train them the proper landing techniques. So to train them, we will actually start with the standing landing drill, which is actually focusing on the hip, knee, and ankle. Then we will be strengthening the non-dominant leg also. Followed that, we can give proprioception training in order to improve the coordination of the movements. Then there is something known as FIFA 11 program. FIFA 11 program is the Federation of International Football Academy has developed 11 program was developed in the year 2006 by the FIFA Medical Assessment and Research Center in collaboration with the Oslo Sports Trauma Center and the Santa Monica Orthopedic Sports Medical Center. It's a complete warm-up program to prevent injuries among football players. So this is basically that program. It's a 20-minute warm-up program which is specially designed for the athletes. So basically it has got running exercises for 8 minutes, then strength plyometrics for 10 minutes, and again the running exercises for 2 minutes. So this is basically the exercise program which has been devised especially as a part of a warm-up to prevent the injuries. So this is again the same protocol which has been set up by the FIFA 11 for the kids as a training protocol. Next important thing is about the stretching. Stretching is one of the factors that can be used to prevent the injuries. So stretching is basically of three types. Basically four types actually: static, dynamic, ballistic, and proprioceptive neuromuscular facilitation stretching. So static stretching, what we do is the stretch position is assumed slowly and gently, and it is held for 30 to 60 seconds and then relaxed. Ballistic stretching is something in which the muscle is stretched to near its limit, then stretched further with a bouncing movement. And you have to be a little careful while applying this ballistic stretching. Next is the proprioceptive neuromuscular facilitation stretching, which is performed by alternating contractions and relaxations of both agonist and the antagonist muscles. So there are some things we need to keep in our mind before applying stretching. So there are these do's and don'ts. So when you are training an athlete, we have to focus on the muscle groups specific to the sports. So for runners, we will be often focusing on the hamstrings, calf muscles, and hip flexors. For the gymnasts or the dancers, we will be focusing on the hip flexors, hamstrings, and shoulder muscles. For the soccer players or the footballers, we will be focusing on the hip adductors, quadriceps muscles, and the groin muscles. Prioritize mobility over flexibility. Don't overstretch. Avoid prolonged static stretching before activity. Focus on the dynamic movements instead. So these are few of the stretching which can be done as a prevention before the before the sports. So this is the pectoral stretch, wrist stretch, upper trap stretch, standing hamstring stretch, quadricep stretch, calf stretch, flexor stretch, piriformis stretch, adductor stretch, trunk rotation, and double knee to chest. So these are few of the self stretching which can be advocated. You can advocate this to your athletes, and you have to just guide them, observe them how they are doing, how much they are stretching. Next, we will be seeing the taping and bracing. Taping is usually done to restrict the undesired movement. So, taping basically, there are many types: kinesio taping, rigid taping. So, good tape should be adhesive, strong, and non irritant. It should be suitable for ankle, wrist, tarsometatarsal joint, and this actually enhances the proprioception and it provides a mechanical support. Talking about the bracing also provides mechanical support and prevent undesired movement. Athlete can put brace by herself. So these are the two important things which can be applied as a preventive measure. Next, talking about the protective equipment, this is very, very important. They shield various body parts against injury without interfering with sporting activities. They also they can also be used on return to activity after injury to prevent direct contact with the injured part. Protective equipment include helmets, face shields, knee pads, shin pads, shoulder pads, wrist guards, gum shields, gloves, etc. Talking about the appropriate training. So appropriate training, there is something known as the weight training, which is very beneficial in improving the performance, especially in case of sports. So there is a women's strength training guide which was compiled by Mr. Robert King, and it suggests that it gives us an idea about how should be the training, uh, how the individual differs in their skill, power, strength, food habits, tolerance. So how should a athlete undergo or do the training? So that is very well defined in this PDF. So you can just check this link. Other than that, there is this globally accredited program which is known as the female specific method. This has been designed to help regulate the hormones which females face during this cyclic changes. There is this PMS, which is known as your premenstrual syndrome, which can affect your focus, and we have seen already these hormones are having some role in creating some kind of injuries. So this basically program will help us to understand our problems, and they will assess us according to our concerns, and they will provide us with the guidelines. And there is this tailored approach which is provided by a team of experts, talking about the nutrition, talking about the hormone. There is this personalized planning regarding how to control all this, what type of food you should have, how should be your training, about psychological assessment. Everything is covered under this female specific method, which is actually an online program. So athletes can enroll them and they can get some benefits. They can get the counseling from the team of experts. Talking about very, very important thing, that is the nutrition. Female athletes should aim for energy availability, especially in case of female athlete triad, of 45 kilocalorie per kilograms per fat free mass day, for optimal health and performance. Nutrient deficiencies are common in female athletes, particularly iron, vitamin A, C, D, calcium. Nutritional strategies should be used to prevent these deficiencies. Micronutrient and macronutrient requirements, as well as hydration, is very important, which has got a very important role with dealing with the various phases of menstrual cycle as a result of hormonal fluctuations. So, inadequate hydration may compromise blood flow to working muscles, thus increasing the susceptibility to injury, which was recommended by the National Institute of Health. So, nutrition is a very, very important part when you are actually training for a female, especially in case of female athlete triad. Next, when you look out for a sports injury treatment layout, so this is the our criteria or protocol what we follow. Earlier, we used to follow the RISE format, which you everyone knows: rest, ice, compression, elevation. Now they are following the PRICE: protection, rest, ice, compression, elevation. Much more advanced one is the POLICE, POLICE, which is the P stands for protection, O is optimal, L is loading, I stands for ice, C stands for compression, E stands for elevation. So this is the first and foremost conservative management treatment layout done by the physiotherapist. So minimizing the extent of injury by following this format: immobilization and early mobilization, therapeutic drugs including glyceryl trinitrate, sclerosing therapy, glucosamine, application of heat and cold according to the condition. If acute, go for cold. If chronic, go for heat. That is what I believe. Usage of electrotherapy, therapeutic modalities, which includes your hydrocollector packs, TENS, IFTs, then shockwave therapy, manual therapy, which includes joint mobilization, traction, soft tissue, massage, MET, that is muscle energy techniques, in order to improve the range of motion. Then one can go for acupressure, dry needling, hyperbaric oxygen, and if the conservative management fails, then depend on the extent and the severity, like I said, surgery may need to be opted, and again follow that there has to be rehabilitation done. So this is the 4 phase sports rehab, which is focusing on the joints and neurological components, the strength and the movement. So when we look at the phase 1, phase 2, phase 3, phase 4, phase 1 is about the early rehab. So joint focus. So early rehab in the phase 1, we will be focusing on the regaining the passive range of motion and active range of motion. In term looking about the neurological, there is this graded motor output and activation done to restore the neuromuscular control. And focusing on the strength, we need to do the voluntary muscle activation, thus focusing on the initiating the muscle contractions. And movements are focused, movements are controlled and predictable to avoid the excessive stress. So movement focus is basically done to avoid the excessive stress in the phase 1. Phase 2 is strength and stability development. So when we look at the joint, so for the strength and stability development, we will start with loading the joint through active full range of motion, ensuring movement is performed through its complete range. So by this phase 2, our target is to achieve the full range of motion. Neurological focus includes emphasis on the proprioception, stability, control to refine the movement patterns. Strength should be building for hypertrophy of the muscles and increasing the cross sectional muscle area. And movement will be focusing, we will be introducing the external stimuli to challenge the system in an organized manner. Phase 3 is about the advanced strength and reactivity. So, joint, we will be focusing on developing end range strength and optimizing the range of motion. Neurological, we will be focusing on enhancing the reactivity and elasticity to improve the dynamic control. Strength, we will be focusing on the strength speed development, reducing fatigue. And movement, we will increase the complexity and effort, integrating more demanding movement patterns. Phase 4 is return to sports. So for the returning of the sports phase, that is the phase 4, we will focusing on the joints to maintain the end range for the optimum function. Neurological focus, we will be maximizing recruitment for the explosive movements. Strength focus, we will be emphasizing speed, strength, endurance, and power. Movement focus, we will be training for the sport specific open ended movements, preparing for the real game scenarios. So these are basically the uh, four phase progression, that is the sports rehabilitation that we plan in our uh, basically we plan. So according to the condition, according to the condition of the injury that the patient that the person has been encountered with, depending on that will be our line of management. So before that, we need to see there is some red flags. Red flags are something when it is known as the emergency situation. So if there is some head injury, if there is this loss of consciousness or persistent headache, which is often complained by your athlete, it's emergency situation. You have to consult it uh, to the physician or doctor or the emergency team of experts. If the patient or if the athlete is complaining of breathing problem, shortness of breath, it's a matter of emergency. If there is some neck pain, abdominal pain, if he's complaining of blood in urine, fracture or suspected fracture bone, serious joint or ligament injury, joint dislocation, eye injury, deep wounds, persistent bleeding, injuries associated with severe pain, or any doubtful injury, these are all the red flags. This has to be treated immediately. Now let's see what are the evidences. Like when I went through a few of the studies, I found that there was this for the ACL prevention, that is the anterior cruciate ligament injury prevention. There was this neuromuscular training program was focused in the athletes, female athletes, and basically it focused on building up the strength, balance, and proper landing techniques. And the result significantly showed that there is reduction in the knee injuries in the intervention group, with a 4.8 times lower rate of the knee injuries compared to the control group. And when the next study says that when this FIFA 11 program was being advocated, so one third of the sports related injuries were experienced less by the female athletes. So this warm up program was found to be really beneficial, and we have to implement this. Next, talking about the neuromuscular training and anterior cruciate ligament risk reduction in female athletes, which was a study research conducted by Sujimota et al. And it also stated that this neuromuscular training program reduced the anterior cruciate ligament injuries in young females by 17%. And moreover, when we look at about the hormonal variations, I was going through a few of the studies regarding what are the cyclic changes, like how to train the female in during their cycles. Depending on that, it was found that during the ovulation, there is this higher risk of injuries because of the ligament laxity, and because this happens with the estrogenic peak. So this was the studies which was being done, and these are the evidences. So these are a few of the points that you need to keep in your mind. So be strong, train strong, stay strong, practice proper proprioception, that is the balance, strength training and balance techniques. You can follow the FIFA 11 program. And let's talk about periods. This is very important for in the aspect of training, nutrition, and injury prevention. You can visit www.fitterwoman.com. Next is the shoe, good shoe type. Okay, the arch of the shoe. The female feet is different compared to male. The female foot is smaller in size. There is this increase in this pronation of the foot. So to decrease the pronation of the foot, we have to select the foot according to our sports. And consistent training surfaces and appropriate shoes should be chosen according to the sport activity. So these are my references. To conclude my webinar with a worthy note by Benjamin Franklin, an ounce of prevention is worth a pound in cure. Thank you.
Thank you, Ms. Nisha, for the insightful presentation. Dear viewers, if you have any questions for Ms. Nisha, please leave a comment, and please fill the survey form which can be found at the comment section at the end of this webinar. And based on that, e-certificates would be awarded. Okay, all right. Yeah, I'm just getting a question which says, how does chronic energy deficiency affects bone mineral density?
Thank you for this wonderful question. Yes, chronic energy deficiency, yeah, affect the bone mineral density. So, like I discussed in the female athlete triad, the females are not getting the adequate amount of nutrition, that is the calcium and the vitamin D supplement. So, because of that, there is this less deposition of calcium in the bones. Moreover, the training is one of the factor which will improve the strength of the bone. And one more important thing is the estrogen hormone. So estrogen hormone is osteoblastic in nature. That means it has the ability of building up of calcium in the bones. So when a female ages, when she ages, there is this there's some amount of decline in the estrogen hormone. So as a female is aging, there is this depletion of the estrogen hormone, and because of that, there can be this osteoclastic activity. That is the bones from the calcium and the minerals from the bone are reabsorbed in the bloodstream. So because of that, there can be deficiency, and ultimately, there is this female athlete triad. There is this low mineral density that can be seen. Either the female will be osteopenic or osteoporosis. That also we can decide by taking up the DEXA scan. So very important thing is the estrogen hormone and the inadequate intake of calcium and vitamin D3 along with proper training. Thank you,
Oh,
sir.
all right, all right. Yeah. Okay, moving on. I'm getting one more questions which talks about, okay, what are the best strategies to educate female athletes, coaches, and parents about the risk of female athlete triad? So I think
Okay.
like the person is asking about the strategies, how to educate female athletes.
Okay. Good question, sir. So basically, female athlete triad, this thing need to be aware. The awareness, the creating the awareness is very important. So this is not only the job of the physiotherapist, it is a multidisciplinary approach. So this team, which is dealing with the females, that is the female athlete triad cases, so they will have of experts like physiotherapists, endocrinologists, orthopedicians, nutritionists. So they have to make aware, creating proper awareness, proper screenings, giving the questionnaires and routine checkups. Screening is very important thing. So because of this, many often they will be feeling fatigue, but they don't know what is exactly happening. So very important thing is screening their menstrual history, their weight, their eating habits, their psychological assessment, the bone mineral density. So everything, if it is optimal, then only they can perform well in their sports. So this is what I believe. uh, Early screening, before that awareness, screening and advocating, all these things will help the females in having a good optimum function, bodily function.
Right. So, like it's not only the responsibility of the physiotherapist, meaning to say the coaches,
Exactly.
the people who are
The coach.
around, all those have to come in to get a good outcome from the female
Exactly.
athlete. Okay,
Exactly,
that's
sir.
that's wonderful. That's wonderful. And moving on, like what I can see is like, yeah, we are done with the questions right away. So we don't have much, like other questions. So yeah, it's time. So again, I'll thank. So we have come to the end of today's session, and thank you, Ms. Nisha, for joining us today and providing us such insightful information on the athlete, on the female athletes. Okay, to our wonderful audience, thank you for joining us at this webinar. We would look forward to your comments and participation in future events hosted by a Faculty of Health Sciences, uh, Nursing and Education at MAHSA University. Please fill the survey form, which can be found at the comment section at the end of this webinar, and each certificate will be awarded. In case of any further queries, you can contact us through our MAHSA website, and you can also visit at our social media platform. And with that, again, thank you, and have a pleasant weekend.
Thank you, sir.